the Black Death's boat bonanza. Let's set sail back to the 14th century, a time when the Black Death was cruising through Europe faster than gossip in a small town. In response, the bustling city of Ragusa, now known as Dubrovnik, Croatia, thought, maybe we should do something about this. And so quarantine was born, not out of sophisticated medical insight, but out of a medieval better safe than sorry approach. The plan was simple. Any ship arriving in Ragusa had to anchor offshore for 30 days, which they later cranked up to 40 days just for good measure, thus coining the term quarantino. Imagine being a sailor after months at sea, dreaming of solid ground and a cold pint, only to be told you've got to float around for another month because the town was a bit wary of your plaguey vibe. Of course, not everyone was thrilled with this newfangled quarantine idea. Some locals on shore would have watched these ships with a mixture of suspicion and amusement, placing bets on which ship's crew would crack first. Meanwhile, health officials, armed with little more than a keen sense of smell and a strong stomach, would eventually board the ships to give the final okay, a process that involved a lot of sniffing, poking, and hoping they didn't bring the plague back to town. In hindsight, Ragusa's quarantine might seem like a crude method by today's standards, but it was a groundbreaking step in public health. It showed that with a little ingenuity and a lot of patience, humanity could take proactive steps to manage pandemics. And as for the sailors, they probably had a few choice words about quarantine, none of which included fun or, please, can we do that again? As the Black Death swept through Europe from 1347 to 1351, it annihilated an estimated 25 million people, about 1/3 of the continent's population at the time. The scale of the pandemic created an unprecedented public health crisis that demanded equally unprecedented measures. Ragusa, a thriving port city, was particularly vulnerable due to its bustling trade routes that connected the East and West. The introduction of quarantine was not only innovative, but essential. The decision to implement a quarantine period of initially 30 days, later extended to 40 days, from the Italian 40 giorni, meaning 40 days, was influenced by the prevailing medical theory of miasma, bad air believed to carry diseases. This period was thought sufficient to prove whether the crew carried the plague or not, based on the disease's incubation period. In fact, the city's meticulous record-keeping, which survives in archives today, provides insights into the bureaucracy of disease prevention. These records detail the ships that were held at bay, the manifest of their cargo, and occasionally the fate of their crew. Moreover, the quarantine station, or lazaretto, wasn't just a floating ship, but eventually included designated areas on nearby islands. These were some of the first rudimentary attempts to create isolation facilities that would later evolve into the sophisticated quarantine systems used in modern public health practices. Typhoid Mary's kitchen nightmares. Move over, Gordon Ramsay, because the tale of Typhoid Mary is the original kitchen nightmare. Mary Mallon, better known as Typhoid Mary, was not your ordinary cook. She had a special ingredient in her recipes: typhoid fever. Mary was an asymptomatic carrier of the bacteria that causes typhoid fever, and she famously denied her role in spreading the disease while continuing to do what she loved: cooking for others. The story begins in the early 1900s in New York City, where Mary worked as a cook for several well-to-do families. Unfortunately, wherever Mary went, a trail of typhoid fever followed. Health authorities finally caught on to this pattern, and a sanitary engineer named George Soper played detective. Soper, whose previous experience probably didn't include interrogating cooks, tracked Mary down after she left a particularly disastrous outbreak in her wake at a vacation home in Oyster Bay, Long Island, where she infected 33 people. Confronting Mary was no piece of cake. When Soper approached her with his accusations and asked for samples of her urine and feces, Mary, in the spirit of true culinary defiance, chased him out with a carving fork. This response was understandable, perhaps, from a cook who wasn't exactly keen on being told her cooking was, literally, sickening. Nevertheless, the public health authorities eventually captured Mary and forced her into quarantine on North Brother Island, where she spent 3 years isolated from society. During her stay, Mary was subjected to countless tests, and health officials confirmed she was indeed a carrier of the typhoid bacteria. Despite this, Mary remained stubbornly convinced she wasn't to blame, her denials as firm as a well-cooked brisket. In 1910, a new health commissioner decided that Mary could be freed under one condition. She had to agree to stop working as a cook and take reasonable measures to ensure she didn't infect others. Mary agreed, crossing her heart and hoping to fry. However, old habits die hard, and soon she was back in the kitchens of New York, this time under a pseudonym. It was like a secret season of a cooking show where the mystery ingredient was always a dash of danger. Mary's second act as a cook led to several more outbreaks, and once she was identified, she was returned to quarantine on North Brother Island in 1915, this time for life. There, Mary spent her days reading, painting, and presumably staying well away from the kitchen. She became something of a minor celebrity, her story stirring up public debates about individual rights versus public health safety. Typhoid Mary's tale is a potent reminder of the unseen dangers that can lurk in our most benign daily activities, like eating a meal prepared by someone else. It also highlights the tragic reality of Mary's life. She was not a villain with malevolent intentions, but a woman caught in a misunderstanding of microbiology and public health. The Philadelphia yellow fever fiasco of 1793. Let's rewind to Philadelphia, 1793. A year when the city was buzzing, and unfortunately, not just with revolutionary fervor. It was also buzzing with mosquitoes carrying the nasty gift of yellow fever, leading to an epidemic that almost turned the city of brotherly love into a ghost town. The outbreak likely began with refugees fleeing a yellow fever epidemic in the Caribbean, bringing the disease to Philadelphia, which was then the temporary capital of the United States. As the fever spread, panic ensued. About 20,000 residents, nearly half of the population, fled the city, including prominent figures like George Washington. Yes, even the man who could not tell a lie decided it was a good time to get out of Dodge, or in this case, Philly. Those left behind faced grim odds. The city's doctors were baffled and overwhelmed. They couldn't agree on how to treat the fever, splitting into camps, some advocating for bloodletting and others for purging. If being sick wasn't bad enough, imagine having a heated debate over whether you'd prefer to be bled or purged, like choosing between two very suspect special offers at a restaurant. Enter the heroes of this story. The Free African Society, a benevolent organization founded by Richard Allen and Absalom Jones. They stepped up to care for the sick, as rumors, unfounded of course, suggested that African Americans were immune to yellow fever. This led to many African American nurses caring for sick white residents, an ironic twist in a society riddled with racial divisions. The Free African Society's members worked tirelessly, burying the dead and tending to the ill, all while navigating the social complexities of a racially stratified city in crisis. Their contributions were immense, yet recognition was scant. Another course in the all-too-familiar meal of historical oversight. As autumn arrived, the cooler temperatures helped snuff out the epidemic, but not before it claimed the lives of over 5,000 people, roughly 10% of the city's population. The epidemic finally waned, but the social and political repercussions lingered. The city's handling of the crisis and the heroic role of its African American community sparked discussions on race and healthcare that reverberated beyond Philadelphia. Venetian villainy and lazarettos. Travel back to the 15th century in Venice, a bustling hub of commerce and, unfortunately, contagious diseases. With ships coming and going, Venice was like the airport of the medieval world, only with more boats and less security. To manage the constant threat of plague brought by these seafaring visitors, Venice came up with an ingenious, if somewhat draconian, solution: the lazaretto. The concept was simple, yet groundbreaking. Establish quarantine stations on nearby islands where both people and goods could be isolated before entering the city. These were some of the first facilities of their kind in the world, specifically designed to prevent the spread of disease. Venice established its first lazaretto on the island of Santa Maria de Nazareth in 1423, in response to recurring bouts of the plague. Imagine being a trader arriving in Venice with your cargo of exotic spices and textiles, only to be told you and your goods had to spend 40 days on an island at the city's edge. Not exactly the warmest welcome. This quarantine wasn't exactly a stay at the Venetian hotel either. You'd be stuck there with a mix of sailors, travelers, and other merchandise, all waiting for the all clear. Talk about networking opportunities. The conditions in these lazarettos were less than luxurious. They were often overcrowded and underfunded, which meant that the quality of care and sanitation was, well, questionable. You might arrive with no signs of disease and leave with a new appreciation for your immune system. On the flip side, these facilities were instrumental in keeping the main city relatively free from epidemics, a feat that other European cities struggled to achieve. Lazarettos also had a peculiar social dynamic. They were melting pots of cultures and social classes, as everyone, from wealthy merchants to common sailors, could find themselves thrown together by circumstance. This setup led to some unexpected exchanges. Some even say that the original idea for Venice's famous carnival masks was conceived in a lazaretto as a way to hide one's identity and social status during quarantine interactions. Over time, the use of lazarettos evolved. They became not only places for quarantine, but also acted as medical treatment centers, research facilities, and even storage areas for goods. The administration of these lazarettos was a complex operation, involving strict protocols and the coordination of various city officials, a testament to Venetian organizational skills. Today, the concept of the lazaretto lives on in the quarantine measures we see around the world, although with far better conditions and understanding of disease control. Venice's approach to public health safety in the Renaissance period set a precedent for managing pandemics, emphasizing the balance between commerce, travel, and health safety. The Great Smallpox Standoff in Sydney, 1881. Let's travel down under to Sydney, Australia in 1881, where a dramatic tale of quarantine and public panic unfolded. Smallpox arrived in Sydney aboard the steamship Lubbock, triggering fear and chaos across the city. The authorities, determined not to let the disease spread, decided to enforce a quarantine, but not just any quarantine. This one involved dramatic ship chases, community uproar, and a touch of governmental overreach. When smallpox was detected, the Lubbock was immediately quarantined at the North Head Quarantine Station, a facility that had been dealing with incoming sick passengers since the early days of the colony. But it wasn't just the ship that got the quarantine treatment. The government, in a controversial move, decided to forcibly quarantine the entire neighborhood of the Rocks, turning it into a virtual prison. Houses were barricaded, and residents were forbidden from leaving. The scene was more reminiscent of a siege than a public health initiative. The residents of the Rocks were understandably not pleased. Many of them were poor and lived in cramped conditions, which made the enforced isolation feel even more oppressive. To make matters worse, the health officials tasked with managing the quarantine were often accused of being heavy-handed and insensitive. Rumors of corruption and mistreatment swirled, fueling public distrust. In one particularly farcical episode, a suspected smallpox patient, believing he was being unfairly detained, decided to make a daring escape. He stole a rowboat and set off into Sydney Harbor, pursued by a steamship commandeered by health officials. It was a surreal chase that captured the city's attention, a small, bobbing rowboat leading a hulking steamship on a merry dance across the waves. Meanwhile, the wider Sydney community reacted with a mix of fear and fascination. Newspapers of the day ran sensational stories of the quarantine measures, the escape attempts, and the government's sometimes draconian policies. It was the talk of the town, providing daily drama alongside deep-seated anxiety about the spread of the disease. The standoff eventually ended when the epidemic was contained, thanks in part to the quarantine measures, but also to the onset of cooler weather, which helped slow the spread of the virus. The aftermath, however, left a lasting impact on Sydney's public health policies. The events of 1881 highlighted the need for more humane and effective management of epidemic diseases, prompting reforms in how quarantines were handled and improvements in public health infrastructure. Flu camps and fresh air. The 1918 influenza. In 1918, as the world grappled with the final throes of World War I, a new enemy emerged, invisible and far more indiscriminate: the Spanish flu. This pandemic, one of the deadliest in human history, claimed upwards of 50 million lives globally. In response, cities around the world scrambled to implement measures to curb the spread, and some of the most innovative and peculiar were the so-called flu camps and open-air treatments. The idea was born from a simple observation. Patients housed in open-air wards tended to recover better than those treated indoors. This led to the enthusiastic embrace of fresh air as a key element in treating influenza. Across the United States and Europe, many temporary open-air hospitals were established. These were not the sterile, white environments we associate with hospitals today, but rather camps set up in parks, on hillsides, or wherever fresh air could freely circulate. One notable example was in Boston, where a flu camp was set up on a local island, typically used as a summer camp site. Patients were transported there and lived in large, airy tents. Nurses bundled up in warm coats and scarves would make rounds, braving the chilly seaside winds. The scene at these camps was somewhat surreal. Rows of beds under tent canvas, flaps open to the cold air, with doctors espousing the virtues of fresh breezes as a cure for the deadly flu. The principle behind this fresh air treatment wasn't entirely misguided. In the pre-antibiotic era, fresh air was believed to disperse the airborne pathogens, while sunlight was thought to kill harmful bacteria. Moreover, these open-air camps prevented the overcrowding seen in indoor hospitals, which was a significant factor in the spread of infections. In addition to the flu camps, many people were advised to sleep with their windows open, and some even slept outdoors on porches and in gardens, bundled up in layers of blankets. Public buildings, schools, and workplaces were also urged to maintain good ventilation, a practice that sometimes led to comically frigid conditions indoors. The widespread use of these open-air treatments created a public spectacle. Newspapers of the day featured photographs of patients lying in rows of beds outdoors, making it seem as though the entire city had decided to hold a bizarre sleepover. Children, perhaps misunderstanding the gravity of the situation, could be seen imitating these setups in their play, arranging their dolls in rows of makeshift outdoor hospitals. Modern missteps. Ebola quarantine blunders. Flash forward to 2014, when the Ebola outbreak in West Africa sent ripples of panic across the globe. As the virus started appearing in the United States and other countries, public health responses ranged from heroic to comically inept, with quarantine practices often falling into the latter category. In the US, the approach to handling potential Ebola cases was a patchwork of state-level decisions, leading to a variety of responses that sometimes seemed more driven by political theater than by epidemiological science. One of the most talked-about cases was that of Casey Hickox, a nurse who returned to New Jersey after treating Ebola patients in Sierra Leone. Despite showing no symptoms and testing negative for Ebola, Hickox was quarantined in a tent set up in a hospital parking lot, a setup that was less state-of-the-art medical facility and more camping trip gone wrong. Hickox's quarantine sparked a media frenzy and a public debate over the balance between public safety and individual rights. Images of her makeshift quarantine tent, equipped with a portable toilet and no shower, circulated widely, highlighting the ad hoc nature of the response. After threatening legal action, Hickox was allowed to return home to Maine, where she faced further restrictions and chose to defy them by going for a very public bike ride. This act turned into a symbolic showdown between personal freedom and public health, with Hickox pedaling away from reporters and a perplexed police escort. Meanwhile, across the Atlantic, other countries were improvising their own quarantine measures. In the UK, anyone returning from high-risk areas was subjected to enhanced screening at airports, which mostly consisted of filling out a questionnaire and having their temperature taken, a process that many criticized as security theater that wouldn't catch anyone except those already showing symptoms. In Spain, the quarantine of an Ebola-exposed dog named Excalibur led to public uproar and protests. Unlike Hickox, Excalibur did not have the opportunity to plead his case and was euthanized as a precaution, a decision that sparked a debate about the ethics of dealing with pets in disease outbreaks. The incident showed that during health crises, even animals could become central figures in the public and media narrative, stirring emotions and controversies. These episodes during the Ebola outbreak illustrated how unprepared many countries were to deal with such scenarios. They highlighted the need for clear protocols and training, not just for handling the disease itself, but also for managing the human and animal aspects of quarantine. The chaos and confusion also underscored the importance of communication during health crises. both to prevent the spread of disease and to avoid unnecessary panic. From quarantine tents that resembled emergency camping setups to international debates over the fate of a dog, the 2014 Ebola outbreak showed that sometimes the response to a disease can be almost as dramatic as the disease itself. It served as a stark reminder that in the world of public health, sometimes the right hand doesn't know what the left hand is doing, and sometimes it seems like neither hand has any idea at all.